a lot of like feedback or a lot of responses that we got were actually that people were feeling isolated in the sense that their family members weren't really understanding how it feels to be in a situation where you are having seizures and you don't know what to expect from how you feel afterwards or when right before you're even going to have a seizure. So it was like a lack of community that they were feeling because their own caregivers or caretakers weren't able to really relate or feel for them. It is an organization or a network that is funded by the Centers for Disease Control and Prevention, CDC. And basically, what we do is when we first organized, we were tasked to create self-management programs for adults living with epilepsy. And over the course of time, we've now are in the phase of actually being able to implement and having these programs more readily available to individuals that need it. It was several years ago, CDC had an initiative for basically really finding individuals living with chronic conditions and having self-management programs. And epilepsy patients were the ones that were really in need. So there's a lot of self-management for people with diabetes and other chronic conditions. But there wasn't too much for people living with epilepsy. And so what we did was there were several universities and organizations that basically kind of created their own versions for self-management. To date, we have about 5 that are what we call evidence-based. So we've done the research, we've piloted them, we've gathered data, collected the data, analyzed the data, and found that there are some programs that have been outdated because of times have changed, and then some that are basically evolving over time and are still useful and being able to actually address specific things that individuals kind of are like struggling with. So in particularly, I actually am from Emory University, and my previous boss, who is now retired, she created a program or Project UPLIFT. And Project UPLIFT is a group-based intervention or program where they meet over the phone or over Zoom, and they are able to basically just kind of talk to a facilitator and a peer facilitator. And from that, it's basically the whole program is just designed to address depressive behaviors or depressive symptoms. So essentially, the program is designed to utilize actually mindfulness-based cognitive therapy and have these individual sessions for a total of 8 weeks. And basically, what happens is in each session, what the participants actually end up doing is they end up kind of gaining skills. So they learn about like different aspects of mindfulness and cognitive behavioral therapy, learn about how to basically really think about their thoughts that they're having and how to navigate those thoughts. And essentially, they're given practices that they do. Like basically in between each week of the sessions, they get practices that they do and they get to build up on those practices. And the idea is at the end of the 8-week program, they're able to actually have basically a toolbox of resources that they can utilize when they are feeling down or when they are feeling blue or when they do feel like, no one really understands them. So they can actually be able to help navigate their thoughts, emotions, and feelings, while they're, dealing with having epilepsy. And so we don't know which one's first, right? We don't know if it's depressive symptoms can lead to seizures or seizures can lead to depressive symptoms. We don't know that particularly, but what we do know is there is a correlation. And what we've found in the past is Especially, I'm from Atlanta. We live in Atlanta. Our public transportation isn't the best. So typically, if you live in the Atlanta area, you have to basically get to anywhere you're getting by car. And for people with active seizures, obviously they cannot have a driver's license or they can't drive. So they are heavily reliant on people taking them places. And this, when Project Uplift was created, it was before the times of Uber and actually even Zoom. So what was happening is they had a conference call set up at the time to be like, okay, well, you can just get on the phone call. You don't have to come to a clinic to have these programs. You can just get on a phone call and you can talk about what you're feeling or how you're navigating your particular circumstances. And that in itself was basically helpful. The program, it was addressing that aspect of it. So it wasn't just because they couldn't drive, but there were other issues. So a lot of during when we had the groups, a lot of like feedback or a lot of responses that we got were actually that people were feeling isolated in the sense that their family members weren't really understanding how it feels to be in a situation where you are having seizures and you don't know what to expect from how you feel afterwards or when right before you're even gonna have a seizure. So it was like a lack of community that they were feeling because their own caregivers or caretakers weren't able to really relate or feel for them. So those depressive symptoms kind of stir from a lot of different moving factors. And then again, it's the medications. Medications have so many side effects, and that can also have. So there's a lot of different factors, not one particular one, but these were all different things that overall we found that there is a link between depression and having seizures. Cognitive behavioral therapy is essentially like it's heavily used in like this like psychology and psychiatry. But basically what it is just like elements from taking your thoughts and how to kind of stop and think about your thoughts and see what those thoughts are leading to. So a lot of times what happens is people feel like this anxiety or they have these kind of like basically like we all do it where we have these conversations that happen in our head but don't really happen in real life. And so it's actually taking a moment to actually stop and think about how you're feeling, what the thoughts you are, and kind of like just kind of tearing it apart or just kind of taking it apart and saying, okay, I feel like this today and this is why I feel like this. So, but is it really logical that I'm feeling like this, or is it just because I'm just being emotional? And it's okay if you're feeling, and that's where the mindfulness comes into, where they combine it, because it's okay to have an emotional aspect and not a logical aspect to your thought, because that is human nature. And so the behavioral cognitive therapy really just kind of helps take their thought process, and basically helps kind of let you think about how you're thinking through things, and then maybe like helping kind of calm that down, and just helping it just be less where we have like that anxiety or that feeling of, okay, let me just go in a deep downward spiral, versus it's kind of to kind of prevent that from happening. Right now, a lot of our programs are still funded via research. So right now, is particularly at at Emory University, we actually have funding from CDC to be able to partner with. Right now, we partner with our local clinics, and what we do is we find our epileptologists and neurologists, and we tell them, we have these programs, they're free of cost. Your patients, just send them over if you feel like, and then we have an eligibility criteria. More so just making sure that they have the basics that they need to be able to participate in the program, which is essentially a diagnosis of epilepsy, but also they have to be an adult. We only offer the program for individuals 18 and over. But we have like a little criteria, and we let them know that, we'd have them send them over to us, and then we contact them, ask them if they're wanting to be involved. And a lot of times they say yes. But what we do is, particularly for Uplift and Hopscotch, we do offer training programs. So we have individuals that actually train professionals to be able to deliver it in their organizations. So there are not that many, but there are organizations around the states that actually will offer either of the programs. But it just is, it's all a matter of funding and capacity. So we have a lot of times, a lot of staff don't really understand the program or what's, available, like what it is, how it's helping the patients. Or it's just there's not enough funding to offer these programs. So what we try to do right now is we try to get our funding from CDC or from other organizations like Epilepsy Foundation, and partner with them and say, hey, we can offer these programs, to anyone that's interested and that would like to be part of it. We're finishing up year one of a 5-year funding cycle, and basically it's CDC's essentially offering us basically resources to be able to offer these programs in clinics. And then we're basically taking that and we're doing an evaluation right now. So basically we're trying to see what it is that is required to have these programs readily available at clinics, at epilepsy serving clinics, so that it can be a program that is maintained and sustained over time and even adapted, because times have changed, times are changing. And so we want to make sure that, the programs that we offer kind of utilize the evolving times, but also are always available for participants that need it, because we do see a positive effect. We see that, patients that are participating in these programs, they feel more connected, they feel more like, I guess, in control of their lives. And that's what we want. We want, to improve quality of life, overall quality of life. We don't want people feeling like, they don't have any resources available to them. So the end goal is to be able to have these programs sustainable and maintained in several clinics, hopefully around the U.S., but it is a slow, unfortunately, a slow moving process, but we hope to be able to eventually get there, and it is getting there slowly. I mean, we are partnering up with a lot of, there's a lot of Epilepsy Foundation chapters that we're partnering up with and offering these self-management programs, and other organizations that also we kind of partner with to be able to make sure we kind of basically spread the word, try to train our individuals, either if it's facilitators or coaches or nurses or whoever it may be for whichever program. I essentially just happened to get my MPH and kind of like stumbled across the Project UPLIFT program and really, I don't know, it kind of resonated with me. I didn't really know what I wanted to do with my career, but when I was implementing this, at the time it was a pilot program for Project UPLIFT, and I didn't really understand it. But then when I started to see how participants were calling me and telling me how they felt so connected and felt like such a, like, weight lifted off of their shoulders, because they could actually like talk to people who could relate to them. And then they like just showed that they had like an improved quality of life, and, their depressive symptoms reduced dramatically. And so to me, like, that was so rewarding. And I ended up, I kind of tried to do different things in my career. I ended up coming back and staying because, these programs I feel like are making a difference. It's not such a like well-known, like epilepsy is not well-known. Seizures are not well-known. A lot of people are even afraid about, talking about seizures or talking about what to do when a seizure happens. But, for this community to have these resources and tools available, it's very rewarding to be able to be a part of that and be able to share that, that we have these programs, and share that there is, tools and resources to help improve quality of life and just help you navigate life post getting a diagnosis of seizures. UPLIFT particularly is a state-by-state basis, so we have to have a facilitator and a peer facilitator within the state, because it's considered, I think there's like a psychology licensing that has to be, there has to be a licensed psychologist that's present for those programs, because they do deal with depressive symptoms. But the other programs can be done outside of different states. So I would definitely recommend just the programs. I'm so glad that you guys have this channel. It's really good to be able to just like kind of spread the word, because a lot of people don't know that these programs are in existence. And the more interest we get, the more we can really advocate for these programs being more readily available. So that's the end goal, really, to make sure that people everywhere know. And the idea of these self-management programs as well is to really target people in rural areas. I mean, we got the cities, we have the major cities and people who have access to that, but people who don't readily have access to a healthcare system or a clinic that's, within a 50-mile radius or even a 25-mile radius, and being able to let them know, like, hey, you don't need to come to a clinic to have these self-management programs. You can actually get some of these done. You do these over the phone and over Zoom and things like that. So